it's going to be in the context of probably friends and loved ones that we've lost, and a feeling of regret that, like, did we do everything we could? Did we find the thing that we could have found if we had just collaborated a little better and worked a little harder? Like, the best way to avoid that regret, like the demon side of that equation, is to try to get medicine to everybody and collect the data and then plow it into the feedback loop of generating insights and then making new medicine to solve that, identifying unmet need and doing it again and again and again. And the more you collaborate, the faster you're going to do that.
Welcome to Unnatural Selection, a show about competition, innovation, and the strategies shaping tomorrow's frontiers. I'm Nick Encina. Each week, we speak with pioneers shaping the future.
In episode 45, Nick sits down with Errik Anderson, founder and CEO of Alloy Therapeutics, a company that's redefining the landscape of drug discovery by building the plumbing of biotech, the shared infrastructure upon which life-saving therapies are created. Like Linux transformed software through open collaboration, Alloy is challenging the old proprietary models of pharma. Errik is a master of innovation strategy, pulling on every lever from the Doblin Group's 10 types of innovation, from product and experience to networks and business models, creating a moat that's not just unique, but dizzying to potential competitors. This conversation goes far beyond Alloy itself. It's a masterclass in how to design culture, align incentives, and think differently about innovation at scale. A gem to close out season 1 before Nick's upcoming season synthesis episode. Errik B. Anderson is the CEO and founder of Alloy Therapeutics, a global biotech infrastructure company discovering while manufacturing and developing therapeutic pharmaceuticals. He started his career at Lehman Brothers Venture Capital and continues his venture work as the GP at 82VS, Alloy's affiliated venture studio, and as the CEO of his single-family office, Ulysses Diversified Holdings. Errik has been the founder or co-founder of a number of successful private and public biotech companies with over $10 billion in market capitalization, including Alloy, Adimab, Compass Therapeutics, Elector, Avitide, and Arsanis. Erik's companies are responsible for discovering over 90 therapeutic antibodies currently under review or approved by the FDA. Errik received his AB from Dartmouth, an MBA from the Tuck School of Business, and studied bioengineering at the Thayer School of Engineering. He is the co-founder and owner of the 3-time national champion New England Free Jacks, part of Major League Rugby. Errik is on a number of nonprofit and for-profit boards, including the Tuck School of Business at Dartmouth. Let's go.
Long bio, Errik. It's so...
You put it all out like that. I was just like laughing a few times, like, oh yeah, I mean, there's been a lot of stuff going on the last 25 years.
Yeah, you know, for someone and I've known you for over 20 years, and you're one of the most humble people I know. So I'm sure you're blushing over there hearing all this stuff. But it's such an honor to have you here. It's been way too long since we spoke, but it's great to have you on Unnatural Selection. Thanks for being here, Errik.
Oh my gosh, incredible to be on this, and just congratulations on everything with Unnatural Selection. Just the quality of your interviews, and this is just amazing to be on it. So I'm really honored to be here as part of that group.
I appreciate it. Who knew for somebody that was winging it?
It's amazing. Like, it's going to be great. It's like, It's incredible what you're doing here. Yeah, I love it.
Well, I'm eager to jump into this because this is the closing episode of the season, and I'm looking forward to talking to you because you and I
realize that, Nick.
Yeah,
I should have brought my A game today, man. Okay,
well, you know, I didn't want to tell you because I didn't want to add the pressure, but yeah, you know, it's been an incredible season with some luminaries, and just really reflecting on my history with you. Obviously, we worked in companies together, and we go a long back, and just really thinking strategically in a number of different things. You think on so many different vectors when it comes to innovation that I'm really looking forward to in the context of Alloy, but picking at your brain a little bit on how you think about innovation strategy, from everything from the science and the technology all the way to the networks and the business models and all the different types of innovations that go into this. More than anything, I think I've learned a lot from you on these different domains. It's going to be great kind of unpacking some of that.
It's amazing to be on this with you. And yeah, as you said, we've known each other for so long, but we've also had the pleasure of working together, both as your customer and partner back at one of your software companies, and be on the board and whatnot. We've done software, we've done biotech, nonprofit work. Like, this is just incredible. So
yeah. No, so it's been great knowing you for sure. So before we get started, I always start with a signature question that level sets and gives an apples to apples comparison for people listening. It also allows the guest, you, to tell us at a very high level what mission drives you. So could you please tell us what need or impact drives your work?
I, for me personally, there's a few different answers to that question. I could say I'm kind of primed with my Alloy hat on today, and so maybe I would start there. So for Alloy Therapeutics and all the work I do in biotech, it is really about making medicine that works. So it's pretty simple. So our mission at Alloy is to collaboratively cure all disease and to make medicine accessible and affordable to everyone on the planet. And that's clearly a crazy mission, right? Because but what I love about it is it's also clear that we can't do it on our own, and that's why we're called Alloy Therapeutics, because we work with others. So I'd say the thing that wakes me up in the middle of the night, because I kind of wake up every day between 3 and 4 a.m. and just I have discipline of just hitting the desk and starting to do work of some sort. And I think the thing that gets me jumping out of bed with kind of my mind on fire of a puzzle to solve oftentimes is thinking about medicine and thinking about that unmet need. And I think the thing that motivates me so much is the incredible breakthroughs that are coming along. Like the thing that keeps me pushing sort of every day is every day there's something new. And you're like, oh my gosh, if I do something extra today, it's going to accelerate the next thing and the next thing, because there are so many things that are working in the biotech field. And there's so many new medicines to discover and technologies, and how do we share and work together. So just that collaborative model of working with everyone to try to uncover new insights and turn them into drugs, so that, if a loved one ends up sort of needing a drug, hopefully you've done everything you can to have done the work between now and then. Yeah, that's the primary thing I would say. At our family office at Ulysses Diversified Holdings, we have a dual strategy of healthcare and entertainment. Healthcare, for obvious reasons, my background is focused on medicine. But in our family, we define entertainment as everything you have in your life that's more than what you need to survive. So it's trying to explicitly say, like, these things are choices, that like there's only like a certain number of things you need. Like you and I both woke up in a bed this morning. We're going to go to in a bed tonight, right? Like what happens between now and then? We're going to eat some food and we're going to move around. Like life is actually very simple when you think about it, of what happens between when you wake up and go to bed every single day. And beyond a certain level of taking care of your basic physiological needs, it's really entertainment. It's these choices you make. So make good choices and be thoughtful about it. And I think also for our family, that helps. That means that you can appreciate the things that you have a little bit easier if you frame them as choices. And so we have two big businesses that we work on. Alloy on the healthcare side, which is this big biotech infrastructure company that touches hundreds of different companies, and big companies, small companies, academics, sovereign entities now. And on the entertainment side, it's mainly the New England Free Jacks, which you highlighted in the opener. But the through line between them is both of them are about building communities and about bringing people together in a shared purpose. And yeah, it's very much. I mean, it sounds kind of cheesy, but that's how I think about it. Is the through line of you just want people to come together around a shared mission, and then also around shared values. And I would say Alloy and the Free Jacks very much have shared values, in part because we help to create both entities. So
Yeah, no, I think you said a bunch of things in there that I want to highlight. And creating community is so important too, because I find, and I think a lot of people find, that modern technology has isolated us more. And so here you are saying, no, 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 let's reverse that.
yeah.
We can actually build community, and we can build partnership around everything from drug discovery all the way to entertainment. And so, number one, I commend you for that, because I think that's really important just for the fabric of our society. The other thing that I want to highlight there, because I think you glossed over it, but for people out there, I think there are two minds here, right? So you said collaborative drug discovery. And I just want to draw that out, because I think anybody that's listening to this that's from the life sciences drug discovery world, their like spidey sense just lit up and they're like, oh, wow, that's interesting. But I think for anybody not in that field, they're like, oh, I don't get it. And so I think it's important to highlight drug discovery is not historically a very collaborative space, right? I mean, pharma companies, like, their IP are their golden jewels. And once they discover something, every patent goes into it and you protect them fiercely, because that's really where you're going to make your next blockbuster. What you're saying is like, no, 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 we can actually do this in a social way.
In a social way where, so I believe something else that's crazy. We truly don't compete with anyone. We are all just in a collaboration to defeat disease. And you're like, that's not true, because I got my company, you got your company, you got these things. Like Pfizer doesn't want to see Novo be successful, or Eli Lilly. And like, Actually, if you put the CEOs of those companies in a small room with a patient, they're both thinking the same thing, right? They're like, what's the best drug for this patient? But somewhere between like that bedside of like having total clarity in that moment to the role that they have and the responsibility they have as the CEO of a multinational global pharmaceutical company, and the diverging interests that happen from your shareholders and your employees and everyone else. You've got mouths to feed and people to take care of. You have obligations that you have committed to as the CEO in that role. And there's a divergence between those two things. But at the heart, in all of our hearts, as scientists and as people in the industry, everybody just wants to defeat disease. And we're just trying to figure out a way to make it work. So we try to create a business model with Alloy where the way that we think about technologies and services, we can be as collaborative as possible. And that there's always a way to make money somewhere in that value chain from having an idea through a commercialization. And if somebody else can do a better job, oh my gosh, thank you. Like we'll let you do a better job. And that way that will accelerate the timelines, it will reduce the cost, it will increase the probability of success of the drug. If you do one of those three things, like you've got a service, great. But the thing that sometimes happens is the counterparty is like, well, I'm not going to do my service for you. I only do it for myself. You're like, okay, well, then we agree we're not competing still because you don't offer that service. So I'm not like taking business away from you here, but I'm going to do what you're doing and probably not as good as you, but at least I can make it available to like 50 other people. So I wish you would just make that service available because we wouldn't have to go do it. But if that's where we're at, like we'll go do that service as well, if that's what you need.
Yeah, it's interesting. And you said something there that being a tennis player, I recently read this quote, I think it was by Roger Federer, where he said, and it goes back to what you said, the pharma companies are your competitors, it's the disease. And I recently read, he said, it's not the player across the net that's your competitor, it's the ball. And when you think about it from that perspective, it really, I mean, when that ball's coming to you in a different angle and speed and spin and all that kind of stuff, your main challenge is to be able to control that and put that ball where you want it. So you need to focus on the ball, less on the person across the net in that moment. And it's not a perfect analogy, but it made me think of it because I just read it like 2 days ago.
It's good. I mean, that's really helpful to think about. Like we personalize competition so much. Look, I'm an owner of a sports team, right? We have, as you mentioned, we have 3 national championships. Like that feels really good. So you can't help but like seeing that as a zero-sum competitive game on the pitch. But I think it really helps your psychology. Like that Federer quote is actually really amazing because it takes you away from hating the person or trying to ascribe so much to the actual person you're playing against as opposed to focusing on the object. I think there's a beautiful analogy there in pharma that like I'll unpack after this as I think about that. But that'll like stick in my brain because I think there's a lot of analogies that really work for biotech.
Well, especially you have no control over that player across the net, but you do have control over that ball that's coming your way at 100 miles an hour. You have no control over your competitors, but you do over that disease.
Yes, completely. And like you say, control, because that's one of the things that having the hope and the belief, I think a lot of what we do starts with what do you believe? One of our values at Alloy, we have 9 values. One of our values is to learn to live in the dark. And it comes down to this idea that you have to have a system by which you can operate that like when you come into a dark room, there's a whole bunch of things that you might know about rooms. You might know that light switches are on walls and stuff, but there, you have a system by which you operate in the dark so that you can find your way to the light. And the other reason why that's one of our values, and I feel really strongly about it, is it also comes down to the lie that like we've all been told, and especially like as co-founders, as founders, you've been told, which is there's a light at the end of the tunnel.
Yeah.
And that's a total lie. Because the person that's telling you usually has no idea if there's a light at the end of the tunnel. And more importantly, there's no light at the end of the tunnel unless you create it. Right? As the small team, as the innovator, as the scientist, as the artist, whoever that is, that the act of creation is something that happens like in the minds and of the hands of the people who do the creation, not by some like mystical external event. It's people doing great things together. And people tell you that there's a light at the end of the tunnel, but the truth is you have to be comfortable with the fact that everything you're doing, you may never actually ever see the light at the end of the tunnel. And you need to have the emotional and the mental fortitude and the systems in place to live in that place and to still have hope when there is no light. Because that's the only way you get to the place that like, maybe there will be something. And so when you say that, like, you talk about the inevitability of us treating and curing disease, like that's what we need more of. Like,
yeah.
It's because by the way, it's going to work. We're breaking down this problem. Like there's miracles of science that become miracles of medicine like every day. Like I can't keep up and it's all I do. and you're like, oh my gosh, that worked. You're like,
Mhm.
you're sending papers around to the team, and like, I have a huge team, 4 countries and 3 continents, and there's like, oh my gosh, like, did you guys see this? You're like, oh, and sometimes we get to be working on some of these things. It's
Yeah.
incredible.
No, I love those pillars that you're talking about. I don't think you call it pillars, but kind of guidelines that you have, because yeah, the innovation process is inherently dirty, and for people that are in it and you've done it successfully, you realize that there are a lot of things you have to build, and part of it is a culture, and that's part of what you just said. You have to be comfortable in the dark, because that's one of the things that how you make decisions in your organization, how you people self-select to be a part of your organization. It takes a certain mentality to be comfortable in the dark. It takes a certain mentality to be vulnerable and come up with ideas that are imperfect at first, and you have to shape them into something that's interesting. You need the psychological safety to be able to do that. You need the adaptability in people to be able to say, like, you've got to live in chaos and make some magic out of that. And so there's so many different elements that are popping up in this conversation
I
alone.
like you say the psychological safety, Maslow's hierarchy of needs. I think about the equivalent of that for business, and it's exactly what you just said. The psychological safety in a small company, even in a big company, at the base of Maslow's hierarchy of needs is safety.
Yeah.
But in your business context with your job, it's the safety of like the confidence that your paycheck will come in. Like, is the company funded? You go work at
Hmm.
Lilly, you know that Lilly's going to have more money next week. You work at a lot of biotech companies, you're like, I think we're good, but like, maybe sometime, right? So that's the more you can deal with the base of that, it actually frees people up to live their potential at the highest part of Maslow's hierarchy of needs.
Exactly.
The way that I think about that for innovation, like, is you can't actually buy innovation. Money can take care of stuff from the bottom up because you're taking
Hmm.
care of needs and you're paying for people's health care and like all of these things. But really what you're going for at the top of the pyramid is people's shower time.
Hmm.
It's like,
Yeah.
what do they think about in the shower when like
Hmm.
you're clearly not paying them for it? Like it's not, it's clearly their personal and their private time. But if in that moment they're like wondering about how do we cure disease? How do we have a breakthrough in discovering this antibody, this bispecific, or this like genetic medicine we're working on? And if you can get them in their shower mode, that means you have all of their creativity, and money can't buy that. Like
Hmm.
I think that's what people miss about innovation is you can set up some of the circumstances that will foster innovation, but you can't scale innovation with more capital.
Yeah.
In the same way that you can't go to an artist and say,
Hmm.
"Oh my gosh, can you paint me like the best picture you could ever paint, like best painter ever?" And you're like, "Here's $1 million,"
Hmm.
and you're like, "Oh, that's good. I'll get that's a 3 out of 10." And if you're like, "For $2 million, can I get a 6 out of 10?" And you're
Yeah.
like, well, then I tried really hard. Like that's what I got for it. I get. And for $4 million, can I make it even twice as good? And for 8 million, like, we just keep going? That's not how innovation works. Like
Hmm.
there's a temporal component to innovation of things that just have to like percolate. The power of collaboration is you're time hacking with collaboration. It's like everything you worked on today and in your whole life, and as you said, we've known each other for like 20 years, like the whole sum of that we can have in this conversation. And like, so your whole temporal being, we can have like a single conversation, like, okay, what do you know about this? Like, hold on,
Hmm.
like, what do you know? And then I can be like, oh, well, hey, actually, what I know about that is this. And like, together we could make something so much more efficiently because the two of us have a trusting relationship and we're willing to share that. You're not trying to screw me. I'm not trying to screw you. We're just trying to make like a drug baby together. They're like, oh
Yeah.
yeah, yeah. Here's what it is.
Hmm.
This is great.
Yeah, no, absolutely, and like you said, it's almost like what happens outside the strict lines of creating an organization, right? Because like you said, you can have tons of money and you can recruit the smartest people, but it doesn't necessarily mean that you're creating the environment for collaboration, for innovation, for imagination, all the things that it's like that X factor that you start putting people together and things start bubbling. You just have to know how to take a small spark and build it into a fire and maintain it through the storm and keep building it and building it. And unless you know how to do that, like that, it doesn't just take, sticks and wood and a match and maybe gas, unless you have a lot of gas, maybe. But nonetheless, it takes a lot to build a fire and maintain it. And so there's a lot of, um, I wouldn't say intangibles because I think there is some science to it, but it's for all the big companies out there that like want to stimulate innovation, it's really not just throwing more money at it. You need a certain mentality and a culture.
There was a really good, I like that metaphor with the fire as well. Because like, who predicted the hurricane that was going to sweep through at like 120-mile-an-hour winds? You're like, no, I
Right.
totally prepared for 80-mile-an-hour winds. Like I did
Yeah.
a good job here. Like, yeah, you can totally take that, especially life as a startup. Um, there's a woman she's a journalist. I would consider her a friend. I think she's very good at her job. And and she's been writing about our industry for a long time. And she's
Mm.
written about some of the things that we've done for a long time. And she was writing a piece on Alloy a while back. And she was like, okay, it was the launch of our venture studio, 82VS, which stands for Venture Studio. 82 is the molecular weight of lead, because our venture studio wanted to be the most boring component of an alloy. We want to be behind the scenes, like small and behind the scenes, supporting other folks.
The plumbing.
The plumbing. We just want to be the plumbing for everyone else's innovation, right? Do anything we can to make you successful. But she's writing about this. And by the way, she totally understands our business. She's a good journalist. I really like her. And she's like a really good person. And she's unpacking the business model a little bit and whatever I'm telling her and how I'm communicating it. And she starts to talk about, it's like, okay, I get it. You give in the venture studio, you give the money to like do the drug discovery, and you've paid the money to for people to have their salary, and you've paid the money for their lab bench and like for their office. And she's describing all these components of like an incubator or an accelerator. And she just keeps saying, I must have been having a long day, right? And she just said like money like one too many times. And I was like, hold on. Just like stop. I think you're a good, I need to not use her name. I was like, I think you're really good at your job. And I really like you as a person. So Patricia, that is not her name. Tell me, if I bought you a lake house with a typewriter, and I paid for all your food, and I paid for the house, and I paid for this beautiful view, and I paid for the paper, and then I paid for your healthcare, and I paid for, and it's like, could you give me great expectations? Like, and by the way, I think you're good at what you do, and I think you're a great author. Like, could you give me great expectations? Like, I don't know if I could. I was like, okay, wait, hold on. But what if I paid for it? And I just kept saying, I was like, could you give me great expectations? She's like, no. And I was like, wait, hold on. And I think I kind of like drilled her down for like 3 minutes on this of just like making the point of like, and what if I found 1,000 lake houses and 1,000 of you, and I paid for all of those things? Do you think then we will get great expectations? And she's like, I don't know. Like, it's kind of like, it's idiosyncratic, and it's not like, it's not cracking atoms. It's just doing something beautiful that is a bit artistic and idiosyncratic. Money, and even at scale with money, you can create the environment, but you don't necessarily get inside that person's head and in their moment with all of their emotions coming together of like that aha, like moment of creation. We're like, oh my gosh, like this makes sense. Here's a drug that works. We can industrialize part of it, but like the act of creation cannot be industrialized.
Oh yeah, totally. And to take that analogy to the end, if we think about AI, yeah, because I think a lot about this, and I think about AI in terms of like, well, is it so advanced that it's blowing our mind because of these incredible things it can do, or is it that we as humans don't really do things that are that sophisticated and incredible to begin with, and we're replicating it? And so, to your analogy, I'm thinking, well, if you took a bunch of monkeys and gave them some typewriters and you had endless time, could they recreate
Great expectations.
Great expectations.
And would you know it? There's so much of how we consume reality that has to come through a time lens. Not to get like super philosophical, but do you know you're experiencing great expectations after all the monkeys like I just theoretically, like totally randomly, like that would theoretically in an infinite universe come out, but then how do you experience it temporally?
Yeah.
And we have one life to live, and it's gotta.
No, yeah, it's one or the other. It's like either endless time with randomization, or it's, you're really worried about 100-year-old lifespan.
Okay, so you've done a bunch of interviews with some awesome people. The AI topic, I bet, has come up
All the time.
Any insights? So where are we at? I mean, we're in like end of 2025 here. We're in the fourth quarter of
Yeah.
2025. Where do you think we stand with our understanding of what is happening with AI right now?
I think it depends on the industry, because I've interviewed people from across so many different industries. So if you're looking at things like genomics, there's high applicability there. If you're looking at interpreting variants, and if you look at drug discovery, you're looking at synthetic biology, there's a lot of application. In other areas, less so. So it really depends on where we are. And I don't think anybody now is necessarily kind of predicting AGI, so artificial general intelligence, anytime in the near future, because I think the current technology is a far distance from that, for me personally, right? Because it's at the fundamental level, it's kind of like an autocomplete, a very, very smart autocomplete, statistically driven autocomplete that can do more than just kind of like do a word at a time. It can actually do sentences and paragraphs and entire chapters at a time. Yeah. But it's still based on the cumulative knowledge of humanity over the last couple hundred years. And so where we want it to be is, I want to ask it, give me an alternative theory to the creation of the cosmos that doesn't build on the Big Bang or anything else that's been written, and it's not going to find that for me, right? And so I think, to me at least, that's where we start getting into AGI. And I don't think that the current technology of this like very sophisticated autocomplete gets us there. That's me.
So what does it get us to? I mean, you're a software guy as well. Back in the day, are you still a software guy? Are you always a
I
software
am.
guy?
Yeah, I'm always writing code.
Yeah,
Yeah.
yeah, yeah, totally. Yeah, so it's up to date. Um, Clearly, like what we missed in the first internet bubble, as you well know, right? There's all these like internet companies, and what software does really well is automating process, and that was certainly a through line in what we've seen in software in 25
Yeah.
years. I think AI and ML for a lot of the things as it's arriving in biotech and healthcare, but we see this in a lot of places. It's doing a really good job of automating some process for us
Hmm.
that we know how to do general, or it's one step removed, or it's like a kind of a relatively small person. So it's not replacing everything immediately, but what it's going to do is make our existing companies more efficient.
Hmm.
And that should take costs out of the system. And
Oh,
then through
absolutely.
competition, that should be a deflationary pressure. Like that should actually bring the things that we consume every day,
Hmm.
like should lower in price overall as a result, which is a wonderful thing. Obviously, there's disruption there with who has jobs in different places, but it's generally, I mean, you're either on the side of progress or you're just a Luddite trying to make everyone poor for the rest of humanity and just like living in a
Hmm.
dark cave waiting for the sun, I guess, to die out in the sky. So
Well, what I would say to that is like, yeah, so historically, software has been great for automating process and creating efficiencies that way. So where I see AI is still that, but at scale. Because now you can factor in the cumulative knowledge of humanity in multiple dimensions. So it's, now it's the multiomics. You're not just looking at genetics. You're not just looking at maybe monogenetic disease. You're looking at polygenetic disease. You're looking at polygenic risk scores. You're maybe combining that with proteomics and metabolomics. So now you think about the scale of the data we can achieve and then the connections between those, because now it can actually find those patterns. So I would say it's still process, but you're layering on top of this almost an endless amount of compute that finds these patterns across endless amounts of data.
I have, that reminds me of is, do you know the concept of transactive memory? This idea, it's about how humans like there are things like we have a long-term relationship. You see this with couples, right? A friend of mine brought me this insight a little while back, and it was like one of the most beautiful things. And he presented it to me as when an old couple that's been married for like 70 years, when the partner passes away, the really hard thing is you lose a bunch of your memories.
Oh.
And I was like, wait, what do you mean? It's like, oh, because actually there's this whole branch of psychology and like and cognition that is called transactive memory, that is this idea that you store things in your own memory, but you also know where other things are stored. And if that partnership that's gone on for decades, you
Yeah.
remember things about your kids and your grandkids because you're like, oh, my wife knows that thing. And then when your wife passes away, you no longer it's not like, oh, and now I'm remembering the things no, no, it's like you actually lose that.
Oh, that's
And as
interesting.
a consequence, you lose part of your identity.
Hmm.
And I think so as we think about innovation, as we think about collaboration, as you like as now as like how I use Chat GPT, like so as we build a trusted relationship, I know that I can always call you up and like ask you a question about some of the things we both know because you're a good person, you'll take my phone call. So we have like
Hmm.
a layer of transactive memory because we have a relationship and because I trust you.
Yep.
And so a lot of what we try to do at Alloy in being the permanent forever company, so I don't know if you know this, but we set up the company with a controlling class of stock held in a trust that cannot be bought.
Yeah.
So as long as Alloy doesn't run out of money, it will be around forever. And
Well,
it can go public, but we'll never give up that control that's then aligned with the mission of the company. Because in part, we want to be the permanent home base for what everyone else does. So when you're a pharma executive and you're fired, and you will be fired because every pharma executive eventually gets fired. Like no one leaves that like cushy, amazing job where you innovate every day and like people like you have all the money and people bring you puzzles and like you're making medicine. It's like rewarding on like every single dimension possible.
yeah.
Nobody leaves that job. And it's like
Hmm.
today's the day that I don't want to do all of those things that are amazing. Like through whatever reason, you kind of get forced out, sometimes gently, sometimes abruptly. And when you do, you should call us because we're still going to be here. When
Hmm.
you were earlier in your career and you were just coming out of your postdoc, or whether you just was a CEO of a top 10 pharma company, we will always be here kind of as this memory banks of the things that have happened. And if you invest in a relationship and in a community with us, like we take care of our community. And so if you're on our side, right, of this collaborative effort to cure all disease, well, then you're working with us, and it's cool. And it doesn't matter if you're working over at Roche or Pfizer or Lilly, like we consider you part of the Alloy ecosystem, or at least where we have our ninth value is one that is, people tell me it's not a value, but it's no tourists. Like, so we talk about this, and really there's an expletive in the middle that I shouldn't say, but it's this idea of like, don't be a tourist. Don't be just like passing through and taking things of the community. And tourists can be very friendly, but what we really need are the people who are super committed to the mission
Mm-hmm.
and who can make decisions based on, are we moving closer to this goal of curing disease and making medicine accessible and affordable? That doesn't mean you make it free, because I think that's actually antithetical to
Yeah.
innovation. There needs to be a
Mm-hmm.
profit motive. But don't be a tourist. And so you don't have to work at our company to not be a tourist. Like, you could be the CEO of a pharma company and be aligned with the mission, and we can recognize that you have constraints over even what's possible as leading a top 10 pharma company, because you have mouths to feed. And that's okay. But when that whole journey ends, what do you want to do next?
Mm-hmm.
So this, coming back to this transactive memory, it's, you can deposit things in our memory and we're still going to be here. You think about the life of a startup. I think that's one of the most challenging things about a venture-backed company, is the only way that a venture capitalist makes money is when they sell our stock. By the way, nobody's being a jerk. That's just the definition of investing. I
Mm-hmm.
think there's a lot of entrepreneurs that misperceive that investors make money when they buy our stock. No, 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 no. That's like an expense. Like, they only make money when they sell our stock as an
Mm-hmm.
investor. So the nature of your relationship is they will sell your stock. And as a founder, that feels like a betrayal if you want to stick around and continue to build. Have you've seen The Dark Knight?
Yeah.
There's I do a talk around culture, and I pulled out the scene in The Dark Knight when Harvey Dent is talking to Bruce Wayne and they're at dinner, and Bruce is like, "Hey, you do a fundraiser with one of my buddies, you'll never have to fundraise again." They're talking about
Mm-hmm.
what Harvey did, and Harvey says something to the effect of, "You, um, if you live long enough, you become the villain, right? You
Yeah.
either die the hero or you live long enough, you become the villain." And I feel that way all the time as a founder of a company where we have a mission that cannot be resolved over a 7 to 10 year fund life.
Mm-hmm.
That, like, if you are the
Yeah.
builder that builds long enough, right? You either sell a hero or you build long enough that you become the villain.
Mm-hmm.
Like, as a
Well.
as a founder and as a builder, that is just like such an acute feeling that, I think when you start your journey, you don't quite know that that's the inevitable end to your
Mm-hmm.
relationship with so many people. But it's true. Like, your best relationships end in the sense of betrayal unless you're prepared, like, openly, as like, I understand what you need, and do you understand me? And so how do you help me get to that other place where I can give you liquidity, either we go public or otherwise, and you can still be aligned with our mission? Like, how do we get across that wall that is so hard to get across?
Yeah, no, absolutely. Yeah, and the journey changes you inherently. As you and I know, startups aren't easy, and so we for good or for bad, it does end up changing us. But if we go back to Alloy, because we've talked kind of like tangentially to what Alloy does, for listeners not familiar, can you give us a quick overview of what Alloy Therapeutics does, and and for my benefit, how it fits into the broader landscape of biotech and drug discovery? And I ask this because we can think about that landscape as you're a biotech company, you create drugs and you have IP around them and you launch those drugs. Then you also have tools providers, and those tools
Hmm.
providers can be in multiple different dimensions. One could be just pure software. So now you have like the Microsofts and the Verileys of the world, or it could actually be like hardware and software where you start getting into the life sciences diagnostics, which are like the Thermo Fishers and the Revities of the world. And when I was thinking about Alloy, there's also the CROs, which also kind of like overlap with some of these, and then a number of other different things. And when I was thinking about Alloy, I really had a tough time categorizing you.
It's okay. So I'm embarrassed that I don't communicate well enough then, right? So to paint the landscape and how we fit into it. So I would describe Alloy as a biotech ecosystem company or a
Hmm.
biotech infrastructure company. So we look like a biotech company because we do drug discovery every single day. This year, we will discover between 30 and 40 drugs for other people, for other
Yeah.
companies, which is just an incredible volume of novel cutting edge drug discovery.
Hmm.
We have half a dozen different technology platforms that we have invested in that are, some of them are patented, many of them are proprietary. It just turns out, another friend of mine Monica gave me this quote. She's working on a venture capital firm right now. And I asked her why she had such a problem commercializing her original business that was building on top of Rosetta. And I was like, it was kind of like 2012 to the 2022 era before there was a Nobel Prize in this area. And she was like, well, Errik, you kind of need a PhD in the technology to use it. I
Yeah.
was like, oh, Monica, that's like perfect. Like that's exactly the thing. That's why we accept the responsibility of being a service provider. So Alloy is a service provider because it turns out if you're like some super talented scientist and you invent something, even if you patent it, even if you productize it, it just turns out like making that accessible to like 100 different companies or even just like 10 different pharma companies, it actually requires you taking the responsibility of performing the service.
Mm-hmm.
Like if you want it used in this decade. And so it's this kind of nature of innovation and how it spreads. Sometimes it takes 10, 20, and 30 years because that's just how long it takes for people to like unpack what was originally there. Okay, so coming back to Alloy. So we're a biotech company that discovers drugs for other people, but we do not have our own drug pipeline.
Mm-hmm.
And that's a really important decision that we made. And we will never have our own drug pipeline. Even we're coming into a decade of doing this company, people are still like, are you serious? Are you sure? Like, you're like, never? Because there's a lot of venture-backed companies, a lot of companies say like, no, we're just a platform company and we're never going to have our own drug pipeline. But the way that you prove that technologies work are by having drugs that work. And so if I were to take a step back and paint the landscape as a first principle at Alloy, it's recognizing that all value in the biotech industry comes from drug in a patient. Meaning like if a patient has a disease and they're like, oh my gosh,
Mm-hmm.
if I had this drug, it would cure my disease. Great. That patient does not care how much it cost us to manufacture it, how much it cost to discover it, how it got discovered. They just want to be able to talk to their doctor and say, oh my gosh, I'm sick. And the doctor's like, don't worry about it. Here's the
I
script.
got you.
Here you go. Like,
Mm-hmm.
my good friend Carl Gordon, I'm sorry, Carl Hansen. Carl Gordon's at Orban. Carl Hansen is the CEO of Accelera. He gave a talk that just brings a tear to your eyes, but I think you can find it online at UATX in one of the videos there. But in that talk, he said something to the effect of a doctor without a drug to prescribe is indistinguishable from a priest.
Wow.
What he meant was
Absolutely.
like you show up in that moment where you're like sick and you come to your doctor and you're like, just I'm gonna die, help me. And the doctor, she just looks you in the eyes and she's like, I got nothing. Like you can give palliative care, you can give support and comfort, and there's a lot of things you can do. But what you really want is a drug that says, I understand who you are as a patient, and like there's this thing that I can give you. Or if you have a
Mm-hmm.
procedure, also equally good, right? If we can go upstream and prevent the disease from happening, perfect. Like we actually want to prevent disease, not wait to cure it with a drug, ideally, right? That's one of the ways that we collaboratively cure all disease is actually going upstream and never needing a pharmaceutical. But in that in that moment where you're like, I got something for you. That's what
Yeah.
that's the experience we all want to have if we end up in that place where we need a drug that works. So the landscape comes down to drug and a patient, and everything else is derivative value. So in order to make a long-term business model work, you kind of need to own a slice of that drug to truly have aligned incentives.
Mm-hmm.
And so how do you get a slice of the drug? Meaning like you actually, when the drug gets sold, you just get a thin slice of it. So the closer you are to the patient, the actual easier it is to get a slice. So if you're the drug distribution company that literally like ships the drug to the pharmacy, it's really easy for you to get a slice of the drug because every time someone needs to order it, like, I mean, there are Fortune 20 companies that's what they do.
Yeah.
And they get a relatively sizable portion of the ultimate profit of the overall process because they're so close to the customer. I feel like you and I talked about this 20 years ago with
Mm-hmm.
like one of the things I learned in venture capital back in, the 2000 era was the companies that were being disintermediated were the ones that were not really close to the customer. These
Yeah.
software companies, these internet companies. And so like you always want to touch the customer. In the case of drugs, we don't touch the customer because we don't commercialize pharmaceuticals, but we kind of touch the customer if you can own the composition of matter of the drug because you did
Mm-hmm.
drug discovery. So that was and by the way, it's really hard and it's kind of small margins and there's not a willingness to pay in drug discovery so that you can make money. That's why there's so few companies that look like Alloy and my first company, Atomab, which still is a private independent company that's just out there slaying it every day, doing a great job. It's a drug discovery platform company. Alloy is like the version of that does drug discovery in one domain, monoclonal antibodies, and now we've expanded it into discovery across 6 different modalities. But then we're getting dragged into a vertical integration. So doing preclinical development, we started a manufacturing company, a CDMO in Oklahoma City in 2020, because there was a gap in the marketplace of who cared about your lone single project. You're a small company and you're just going from gene to GMP material to dose your first 50 patients. And the big manufacturing companies just don't care about your project because you can't pay them a lot of money. They're actually worried you're never going to get financing, so they don't want to tie up a slot. There's a whole bunch of like very rational reasons why they don't care about a company with one drug. And yet nearly 2/3 to 3/4 of all of our innovation in pharma actually comes from small companies that then become bigger companies or get acquired by big companies.
Oh yeah.
We got to feed that innovation, right? So we started a CDMO called Wheeler Bio. It's in Oklahoma City. I have a great partner, Christian Kennedy, who has been an amazing. By the way, he comes from like oil and gas, but he's more like on the E&P side. Which the close you want to talk about innovation in other places. Like I would highly encourage you to have him on or someone in like the E&P business,
Yeah, I'd love
because
to.
that's the innovation thing that surprised me. I'm like, whoa, wait, hold on, time out, CK. How is it that ExxonMobil doesn't do their own discovery work? And then what I realized in asking him that question is he could like turn it around and be like, Errik, I'm out. How is it that Pfizer is having you do any drug discovery work? Like and it's like, oh my, like it's got to be the same thing. So like understanding how exploration and production work, like so the upstream in oil and gas, actually you learn a lot about exactly how bureaucracies and innovation work in pharma as a sort of a general trend. So you can like, now that I'm saying that out loud, you should totally have him on or someone like
Yeah,
Christian.
I'd love to. I actually have an episode coming out. Actually, I think it's next week, which is on extractive metallurgy. So the idea of taking metals or jewels and so on, it could be Exxon, it could be gold, any number of different things, and then they have to extract those fine minerals from whatever we're extracting from the earth. And so it's the same thing. It's kind of like, there are people that mine. What they do is now they convert that into iron or steel or diamonds. And so the person that I have, it's next Tuesday. It's Matt Humbert from Sataway Labs that does exactly that.
Okay, interesting. Well, and then you look at, oh my gosh, now we're like jumping over. So you look at like Rockefeller and the innovations that he had in fractionating oil,
Yeah.
right? That's what people only know like as the kind of the story about Standard Oil and like the end game. But in the beginning of the story, it's like a technological innovation that just turned waste products into valuable products. Like
Hmm.
how do we that's a general principle that we had, is how do we turn waste streams into value streams?
Yeah.
And I would say that that language, I'm not sure if this is where I first heard it, but like I'm going to give credit to Charles Koch and like Koch Industries. That like I would ascribe that to him. That's when it really like sunk in, was learning about Koch Industries, of turning, how do you turn waste streams into value streams? Because it's what other people throw away. If you can find a
Yeah.
utility, it's not that you can make money from that. You're actually making the world a far better place, because
Hmm.
the stuff that was just inefficiency then becomes new products.
Yeah.
And Henry Ford had versions of that, right? So the old stories of Henry Ford, when he put the specs on how the engine blocks would have to come to the Model T. I'm sure you've heard this story where it's like, oh no, it had to be, the wood had to be exactly like this wide and this grade for the box that the engine came in. And then they would open up the boxes and use it as the floorboards on the Model T. And so he got his vendors to basically like pay him in like a different currency. So at Alloy, we think about this all the time. How do we get paid in different currencies? And so that's one of the ways you can have a non-zero sum game, is that so many businesses, and what allows us to be more collaborative, so many businesses need to think about revenue and expenses in this quarter, like literally in this like reporting quarter. If you're public, like that's what we fight over is, okay, am I going to pay you this quarter? Like, am I going to buy some this quarter? You pay this quarter. So we talk about payables and receivables just in a simple way. But if you can time shift that payment, I would argue it's like paying in a different currency. So if you're like, Nick, you know what? I know your business really needs cash this year, and my business is strong. So why don't you pay me next year? Like I have something to sell you. By the way, it cost me something today. This isn't like software where it's like something. It's like, no, it's like, actually I'm accruing the cost of this. It cost me like $100. I'm going to sell it to you at list price of 200. But don't worry about paying me. Why don't you pay me next year? Because you need cash. Like I'm still getting like the $200, but $200 next year is a different currency than $200 this year.
Yeah.
Now think about if that time shifted payment was 10 or 15 years out.
Just a loan.
It's kind of a loan, but if you own a slice of the drug product, so in Alloy's case, we help to discover novel medicine, and we every day we try to sharpen the axe and be better at it. I think equally importantly, we try to understand the needs of our partners. So not just like the customer that's coming to us, but like, will this medicine work? Like based on everything we know of our history of discovering hundreds and hundreds of drugs, Like, is this a good idea? Can we help here? And, whether they're paying us for it or not, you get that for free, like all of our expertise. And we want that. And there's only a certain amount of money you can charge for that. By virtue of the fact that we also have a small royalty, like typically a low single digit percentage, it means that we're also super motivated to try to get paid 10 or 15 years from now when that drug gets approved.
Yeah.
So even when it leaves our shop, and this comes down to the forever business model and a bit of transactive memory, and try to how do you cultivate a process, a culture, a company that actually has people coming back to you for 5 and 10 years. Well, if you come back to me in 5 years and you're like, hey, Errik, that drug we discovered together, thank you, by the way, I haven't called you in 4.5 years. It turns out I have a formulation problem. Like we manufactured this and I want to formulate it here because it's going to work better as an injectable than an IV. And I'm like, oh, Nick, thanks for calling. We actually invented a formulation technology. We have a process. We did a collaboration with this other company. We should here you go. Here's the formulation technology that we have access to. You can have it for that drug.
Yeah.
And you're like,
well,
well,
go ahead.
We don't even have to charge for it.
Yeah.
Right. Because we already own a slice of that drug. We're already partners. The increased probability of success of the value of that single digit royalty is actually so valuable, especially now that you're like 4 years closer or 5 years closer to success. It's so valuable. We can say, you know what, you can have this for free. And like, why would you do that? Because you're just a nice person. You're a philanthropist. And I was like, well, it actually, as a cold-hearted, blood-sucking capitalist, you could actually, it kind of pencils out that you actually make more money if you do that. Because if you've increased the probability of success of that drug getting approved, everybody makes more money and patients get a drug that works. So it's a non-zero sum game, but a few things have to happen. You have to be willing to be paid in currency 10 or 15 years from now.
Yeah, you got to have the patience.
Which is very hard, right? And you have to.
Well, and especially, if you're operating like a pharma company where you do have quarterly returns, and so you have managers that are dealing with that. You have the luxury of saying, no, I'm actually in the long game, and we're investing into that. But you're building the culture from the top down. So your managers that report to you, they're presumably not on a quarterly return basis, because otherwise they would destroy that model.
It would. I've actually thought, Nick, if Alloy goes public, when Alloy goes public, I've thought about maybe I'll make it an explicit policy that my employees are not allowed to own any stock. Like do the opposite. Do the opposite of what we think is the right idea. Because clearly that's a crazy idea. I think one of my mental models is Opposite George, is the Seinfeld episode where George, we've talked about, because I've had this mental model for 20 years. I know it back in New York, right? Where remember when George just did the opposite of anything, and then he became,
and everything worked.
And everything worked. Yeah. So whenever it goes through my head that something is not going to work, it's impossible, I've just done this for so long that immediately the next voice in my head is what about Opposite George? What would Opposite George do? And you're like, I don't know, maybe the opposite would be true. So if you apply kind of an Opposite George mentality to that place, what would be the opposite of doing that? It's kind of an interesting thought exercise there.
Oh, 100%. I mean, this is also why I was so interested in talking to you. I mean, other than our history together, you're one of the few people that aren't afraid to challenge the status quo and think about and take the mental energy, because it does take mental energy, to think about what the optimal solution would be and work backwards from that. So I'm in the world of genomic newborn screening now, and we're trying to think about how to retrofit genomics into the traditional newborn screening world. And so a lot of the thinking is, all right, how do we retrofit that? And it's not going to work. It's it's really kludgy. It just, that model doesn't necessarily support it the right way. And an alternative solution is well, if we're starting from scratch with genomics in hand, how would we do it? And then we're not going to have a perfect system, but then how do we retrofit that with the current system? And you're doing that because a lot of what you described, and for the record, I didn't mean to call you out in the beginning that you do a poor job describing your company. You do a good job. So how you described it is how it was in my mind. What I was struggling with is your model of saying what Alloy does is this collaborative drug discovery infrastructure. It's not a category. So you're creating a category that I know of, because I don't know. It's not CRO. It's not services. It's not infrastructure like software platforms. It's not biotech. You're like a conglomerate of all those. And so that's where it wasn't you not conveying it properly. It's more like what you're creating. And I think it goes back to what I just said about you, right? What I think you're looking at, what I think the listeners are picking up is, you have this ability to just take a massive step back and say, what's an ideal scenario? an ideal scenario is, okay, maybe like this whole kind of like hoarding IP as a biotech company, it worked when we were picking low-hanging fruit, discovering drugs or, chemicals and compounds for the last 50 years. Science is becoming far more complex now. It's almost now you need that infrastructure, you need the AI layer. It's not going to be an all in one person's head. It's going to be in many people's heads in many organizations. And if we want to start picking at the higher hanging fruit, the more complex science, the more challenging medications, if you want to go towards really difficult stuff like curing things, well, that's going to take collaboration. And the current system isn't made for collaboration. So how do we reinvent the system? This is what I'm hearing.
It was in reinvent the system. Like you're actually like nailing it. And I think about this stuff all the time as it relates to my business. So you're actually doing an incredible job of describing this, of describing what I think is the opportunity and the challenge, right? How do we, I think it first comes to, we always look for analogies. Like, oh my gosh, are you going to be the next Regeneron? Are you going to be the next Genentech? And
I
that's like,
think of you as being like the next Linux for drug discovery.
I mean, I love it. And if you can be, well, I'll leave you with an ancient Chinese proverb that we just made up like last year, which is the 100-armed octopus does not lose sleep over a missing appendage. And what we mean by that at Alloy is have a business model where you can find at the end of the day, only one thing has to work and have enough margin so that you make at least $1 of profit. And the value of what we are doing should be measured in terms, some in revenue more so than profit. Although profit, when you commercialize a drug and you have a thin slice of it, like when a drug works, there's always somebody's always going to make money. So, well, we are not a nonprofit because I think the profit motive is very important. But what we do with our profit is our choice, right? We reinvest 100% of our revenue into innovation and access to innovation. So I think the trick is, or where we can be confusing when people from the outside look at us and they try to say, man, are you like Charles River Labs, which is a phenomenal company, right? It's a publicly traded company. I think CRL touches every single drug program at the FDA. Like you would say like, oh yeah, like we like safety tests and everything they do. And you can see the scale of the business and what they do. And their leadership is fantastic and the quality of their work is fantastic. They end up with sort of a thin slice of the drug because they charge, they don't get milestones and royalties, but they charge something along the way. And I think they literally touch like every drug.
That's amazing.
But we're not quite like Charles River because we have aspects of our business on the discovery side where we can temporally shift those payments. Like we can play with time in a way that's like really challenging for Jim to play with. No matter what he wants to do, he's kind of there's aspects of his business model that kind of box in the choices he can make. So we can lose money in one place to make money in another place. And what we look to do over time, like the North Star, where we're headed, is that we're collaboratively curing all disease. And so as long as we're moving in that direction, right, you either stand up for that mission or you're standing in the way.
Yeah.
That's how I think about it. Like which side of this are you on? Like,
Mhm.
like it's like, maybe you're not against us, but you might actually just be in the way. So how do we get closer to that? If I were, okay, let me leave you with this. And maybe I shouldn't say this because this will be posted and people will see it publicly, but I'm just going to say it. I kind of just want to be the Walmart of biotech. What I mean by that, and being like kind of the Walmart of biotech, it's not a perfect analogy. Do you know Walmart's mission statement?
No.
Do you remember? Like you see it on the side of the trucks. If I say it, you're going to remember it. It's to save people money so they can live better lives or like live
Yeah.
better, right? I actually think that is the most beautiful mission statement of a company ever. It's like so direct and pure in like an understanding of something that everyone else gets wrong, right? I think Sam Walton understood something really important, and what I think he understood was that wealth comes not from having more money, right? Which is what everyone believes. Like you're wealthy because you have money, but that's not true.
More
You're
time.
wealthy because you can afford everything that you need to survive. And so a business that is focused on innovating, Walmart has done phenomenal innovations, all in the service of making good stuff for people and getting it to them at a reasonable price, everyday low prices. Again, we save people money so they can live better lives. That he has a mission statement and a company that has scaled and that operates on a very low margin. Like there's a lot of people look at that and they're like, oh, other companies are better because they're like higher profit margin. Couldn't they do a better job of profit? I'm like, well, I think you're missing the point. At least, you kind of listen. You listen to what Sam said, and you look at them, and I they believe something different. So it almost comes back to what we were talking about. What do you believe? Like, where does
Mm-hmm.
hope lie, and what do you believe is true? And so if you believe that you make people's lives better by saving them money, so that like when the Walmart moved in close to our farm town when I was little, that you felt the increase in the wealth of your community go up overnight because your hammer was more affordable,
Yeah.
and you need a hammer and like to like do your work on the farm.
Mm-hmm.
That like I think when you grow up poor and you like and you see that and you feel it really intuitively. And so I just want Alloy to be the layer that helps everybody increase the probability of success, reduce timelines, and reduce costs. And that we are a company that is not an academic, right? We're not biotech and we're not pharma. And service providers, CROs, CDMOs, like they service all three of those groups. But those are the three constituents that are involved in making medicine, right? You got academia doing basic research, you have biotech doing translational, and pharma does both of those things as well. And then you have pharma ultimate that commercializes. And if you
Mm-hmm.
grow up long enough as a biotech company, you become a pharma company.
Mm-hmm. Yeah.
So there's those three constituents. We built Alloy to be different intentionally. Like never having our own drug pipeline is a choice so that you don't end up becoming a biotech or a pharma.
Yeah.
You're
The
forced
temptation isn't there.
the temptation and the misaligned incentive of like
Mm-hmm.
I mean, when you have 100,000 employees and you're like, oh my gosh, like I've got a drug that works, but my competitor has this drug that might be better. You know what you can't think about is how do you make this other drug successful? Like
Mm-hmm.
that is not your job. Like you are not being honest, and you lack integrity as the CEO of this first company if you are undermining the 100,000 employees you have and all of your shareholders. Because what you said when you came to work in the morning is like, look, I'm your leader, and I'm going to lead this business. And if you kind of look across the way there, and you're like, I think that guy might have a better drug, you're in a conflict scenario with maybe what is the morally correct thing. But this is not about morals. It doesn't make you a bad person to try to maximize your success over here. We wanted to build a company at Alloy that could say, I just don't want to end up in that box of the game theory. Like
Mm-hmm.
that's not the incentive that we have. And of course, our incentives shape our perception of reality. So the more we can strip away those incentives, I think we end up with a clearer-eyed view of what's possible as well, of like as it relates to innovation. It's like
Yeah.
innovators dilemma stuff, right? It's like you
Uh-huh.
can't see innovation, you can't put yourself out of business in part because all of your incentives say you shouldn't innovate because
Mm-hmm.
I'm going to lose this cash cow that's just delivering so much value to my company and keeping all of my families employed. And I just went to that company cookout and I met everyone's children and grandchildren. I don't want to see them lose their jobs. Like it's my job to make this company successful. So we wanted to build Alloy as a different business where we could take the incredible long view. You could take the 100-year view. I won't be around when it happens. But as long as we make $1 of profit and we're plowing that back into innovation and access to innovation, and we're working to collaboratively cure disease, I would argue we look more like Walmart than perhaps like Eli Lilly, and that's okay.
Yeah,
Like,
no, and you know, I mean, I threw out there the idea of Linux because as I was thinking about the way that you built this, and you mentioned already, like it's the plumbing, and Linux was the plumbing. There was plumbing before. There was Microsoft. Everybody was on Windows, and Linux came around and said, you know, we can open source this. I don't need to own the whole thing. And in fact, if I open source it and other people build on top, and they build higher value solutions on top of my infrastructure, then we actually accelerate and we do things as a community that's far better and faster than one company can do. And so when I think about Alloy, it's like you mentioned like the plumbing, it's the infrastructure, it's the operating system, and you have, you know, you apply towards discovery, towards development, towards different features of the drug discovery process. You free up the drug companies, the biotech companies, from having to do that infrastructure. You take care of it. You can layer services on top, intelligence on top, all the things that you specialize in. They can focus on creating those drugs. And then eventually that almost becomes a marketplace in and of itself. And so I kind of think of it more as like a Linux with an app store on top of it than maybe a Walmart that is a closed garden.
okay, that's fair. Walmart though certainly invites anyone to come in. There's like the category champion, in the chip aisle.
Yeah.
I'm not sure who controls the chip aisle these days for Walmart, but it's like let's just say it's PepsiCo. It's like Frito-Lay. Um, yeah, their job as the category champion is to
True.
maximize revenue in that aisle, whether it's a
Hmm.
Pepsi or a Frito product or some other product. Um, I think it's a little bit yeah, Walmart's a little bit closed because they got their whole logistics and like retail link and everything they do. But I love the analogy of like you come to the marketplace and it's there and people can bring their wares in. I think what's really important in that is that how culture reinforces behavior and like our values reinforce behavior. So we wouldn't let just anybody to the bazaar, into the marketplace. It'd be like,
Mm-hmm.
look, are you a taker? Are you a tourist? Because if you're a tourist and you're trying to show up here and just take things away from other people, we're just not going to share with you. And like, because I'm sorry, it's just like life's too hard, and this work is too hard. What we're looking for is people that have a shared value system, and sharing, by the way, doesn't mean that you give things away for free. This is not philanthropy. It means that there's sort of the mutual benefit that comes from trade. Right. This is just
Mm-hmm.
like if two parties enter into a willing transaction, right, then everybody's benefiting. That's just right. I don't have to teach you that. So we want people to be able to present themselves in an honest and a direct manner where it's a multi-game interaction. It's a multi-round interaction. And I think if you always, as a philosophy, right, if in game theory the game always breaks down in the last game, right? So because at that point everyone's like, all right, well, whatever happened before, it's all off. We know this is the last round of the game. So what you have to do is to create a game that goes beyond the last round. There's always something more.
Mm-hmm.
So one of our other values, we look to be generous when others are needy, greedy, or fearful as a principle, kind of pulling off the old Warren Buffett quote around trading inequities.
Mm-hmm.
And what we mean by being generous has nothing to do with money. It has because our scientists, our team members don't actually exchange money with their internal and our internal ecosystem and our employees, and usually not with our customers either. Like there's very few interactions that involve money. But it means showing up and doing like the hardest work you can and taking great
Mm-hmm.
care for the work that you're doing and I mean maybe getting a good night's sleep so that you can actually be a good partner today. And so if I was creating the marketplace we're in or the app store, I, I I think it would have rules that like
Mm-hmm.
you kind of the rules of the game is, hey, here's who we are as a community, and if you can live by these rules, we would love to have you in. And if you can't live by those rules and you're somewhat exploitive, there's like some other dangerous app store out there that you can go
Yeah.
throw your stuff on.
Well, I mean, this is also just part of like the whole we were talking initially about what it takes to innovate. And one of the key things in many respects is having a clear sense of what value you create and what purpose you serve, which starts with your mission. And then everything flows back from that in a way that you align people's thinking, the culture, their activities. And so what you're saying is you looked at how would this work in an ideal scenario? And then you created a mission around that, around collaborative drug discovery. And then you set up systems and frameworks so that everybody in your organization, including your partners, are perfectly aligned on the objective so that there is no conflict of interest. I succeed, you succeed, our partners succeed. We all succeed if we do the right thing. And so it seems like a lot of what you're thinking is in terms of these kind of like these flows of information, flows of energy. And the other thing you and I talked about in other times have been things around kind of like the Dublin Group's framework of 10 types of innovation. And I think that's so critical here. I usually don't bring it up in interviews because it starts getting into like theoretics about like how you innovate and different frameworks that you use for this. But you think along so many different vertices. And it's known too that the more vertices that you innovate across, the harder it is to replicate what you do. If you do it just on features, and it's easy to kind of copy features, but if
Okay.
you innovate on features and in networks and on profit models and all these different things, and you do them all in multiple different ways, that it's almost mind-boggling. Like I think we could unpack this interview into multiple interviews to talk about how you think about these 10 types of innovation to redefine drug discovery.
We and so we're not intentionally innovating across those multiple things. It's like by necessity.
Mm-hmm.
Like, well,
Oh yeah.
this is standing in the way, so I guess we got to go change something here. I think it does help to think backwards from our mission of like,
Mm-hmm.
look, we're just trying to make medicine, and it also really helps that there is profit in this industry when you make medicine that works. So
Mm-hmm.
the willing that's why at our family office we have this dual strategy of healthcare and entertainment. It came from this observation 15 years ago that in the end game, when the software and the robots make everything for us, you'll pay anything to be well. If you or a loved one or a pet is dying, you'll pay anything for your
Oh
health,
yeah.
and everything else is just entertainment after you've taken care of your like basics in your life. So it's kind of thinking out to like an end game scenario of if you're building towards that scenario. So that's why we end up in healthcare and entertainment. Um, so it's also I think we have an advantage in our industry in biotech or in pharma that there is a willingness to pay that you don't necessarily see that like incredible willingness to pay in other areas. hitching up that profit motive to innovation is really, I mean, that's a lot of what we're trying to do. Like that
Oh, yeah.
gearbox, getting that gearbox right is what it was like super powerful.
Mm-hmm.
I think so many of our verticals, whether you're a manufacturing vertical or you run a clinical trial or you're doing pharmacology preclinically or antibody discovery or any one of these individual things, we optimize to our local maxima of like each
Yeah,
of our models. And when you kind of put those together, it's not necessarily the global maxima in terms of
totally.
maximizing probability of success and like drugs to a
Mm-hmm.
patient. And there are entities that think about this in terms of longer time horizons. There's nonprofits, there's governments, there's visionary leaders that think this way. I think it's harder for a public company to take that because just there's restrictions on a public company. Um, but that's where we can maybe be helpful as the company that we are because we've never made any promises to the contrary of our current business model. Like
Mm-hmm.
we funded it out of our family office. It was 3 other family offices that came in early. Um, you know, we count Peter Thiel as one of the first family offices. His family office came in, and I'm very proud of that interaction. And his organization has always been supportive, not necessarily agree, but has been supportive. And 2 other family offices that are very large. And we just said, hey, here's what we're trying to build towards. And then some great venture capitalists came in. So right with Peter in the beginning was Alex Kolasich at 8VC, with Joe Lonsdale at 8VC. And I think there's an element of like, I'm not sure this is all going to work, but I think we're going to figure it out together. And so we have
Uh-huh.
this like phenomenal support, and they're traditional venture funds. So we know that there's a fund life aspect to what they do, like they're a fiduciary to capital. And so when you take someone's money, you have an obligation to be good on your side of it. So we'll eventually be public and we'll find a way to help them get out. But we had the benefit of family offices thinking in long-term horizons, agreeing with this
Mm-hmm.
business model. And we had the benefit of AVC being our largest investor of almost defending us against other venture models that might have been contrary to what we've been able to build together. Um, and then we have a few sovereign funds that came in and some other folks that kind of thinking about some longer term capital. And now in 2025, we arrive at starting our sovereign innovation division where we package up everything we have and you take it to another country and you say, so I was in another country earlier this year and I heard from somebody, it was a family office trip, and I heard from some family offices where he said, effectively, I'm going to paraphrase, we wonder if the destiny of our people is to continue to export oil or if there can be something different.
Hmm. Yeah.
And you're like, okay, so what do you think?
Uh-huh.
What do you believe? Like, I know what I believe is possible. Like, let's look around and let's start having a conversation. But in those conversations with the family offices that are the leaders of this country, you start to ask the question of like, do you believe that you can make medicine here and export it to the world? Like, is the destiny of your people? Do you believe the destiny of your people is exporting other things? That like, do you believe you're good enough to do this?
Mm-hmm.
Because by the way, in what we do, the big consulting companies will probably tell you you can only do this in Boston and San Francisco, and that's not true.
Yeah.
Like I grew up in a farm in Western Kansas. Like everyone tells you that like between the coasts there is nothing. It's like it's the equivalent of where we're standing today in the Middle East and having this conversation, but they're
Mm-hmm.
totally wrong. Like they're completely wrong. That like we
Oh,
have the talent, we have the ability, the training is there, but it's also just the knowledge. And so the explicit knowledge transfer that we have, process technology, like
Mm-hmm.
if you believe that you think the future, the destiny of your people is making medicine and exporting it to the world, I will replicate everything I have and everything I know.
Yeah.
And I will bring it here openly and willingly and honestly. And I think there's a way that we can take like a small slice of that revenue and that'll make at least $1 of profit for me. And but I can believe whatever I want, but it's you have to believe.
You need to believe it. Yeah.
Yeah, you have
No,
to believe,
I,
and like your government has to believe, and like everybody,
uh-huh.
when the you, it's like a collective you.
Yeah. Well, that's the reason why I think a lot of people say it's in the coast because you need that infrastructure and you need to bring it. Somebody like a Saudi prince might be able to bring all that together, but it takes a lot of effort. And I can also see like your investors saying, I don't know if it's going to work, but we might as well try because since I've known you, you like to launch for bold and audacious things that seem and sound like I don't know if this is real, but like your energy and your intellect make it so it's like, but if anybody can make it happen, it's you. So with that, I know we're running very short on time, so I do want to zoom to a final question, Errik, that I think is going to be really interesting to hear your perspective on this because if we fast forward to some point in the future when you can look back on your body of work and you already accomplished so much and you're nowhere close to being done, what would be the best case scenario to look back that would make you feel you achieved the full impact of what you were capable of? Like, what accomplishments or changes in the industry would make you the proudest and give you a deepest sense of fulfillment when you look back?
I mean, that's hard. Um, I think the super honest answer probably relates to my family, which is like it seems very small.
I don't
Um,
know.
that I just want them to grow up. My children in particular, Emily and I, raising our 4 children. I want them to have the opportunity to find the thing that they can work really hard at, and like
Mhm.
find the joy that I have found in being able to take risks and build things, and like the satisfaction that comes from working with other people and like being in a partnership. Like there's a limited number of partnerships you have in your life that are truly close and meaningful. And I feel like one of the gifts we have at Alloy and the way that we collaborate is we get to be in the middle of somebody else's passion.
Mm.
And it's like what they thought about like maybe their whole life. Maybe
Yeah.
like everyone in biotech and pharma, like sorry, oftentimes there is this story of like some of these are like horrific stories. Like my child died of this disease. And you meet them in this interaction, you have a Zoom call, and you're like, I just want to help. And something works. And there's like something you can do there. And like there's like no greater reward or joy in that. And so, but I would say like kind of bringing that down to a level is I hope my children can grow up and find like their thing that they
Yeah.
want to work so hard at. And it doesn't, I mean, they can be a painter, they can be an artist, but like find the thing that you really just want to grind at that like it really
Mhm.
drives you. Um, if I were to answer the inverse of that question, and I think this is probably like just the dark side of like an entrepreneur's personality. I don't, you know how sometimes you don't, actually, let me know if this resonates. Sometimes you don't know if you're chasing angels or you're running away from demons.
Oh, yeah, I know that.
Like your mind
Mhm.
is on fire and you're like, I think I'm doing the right thing. I'm trying to make medicine here. But at the same time, you're like, am I actually running away? Like, am I running away from something?
Yeah,
And,
is it light energy or dark energy that I'm running towards or away from?
hmm and I would say, I know that part of my desire to collaboratively cure all disease is both. And I would say on the dark side, it's, I could never live with myself if I didn't do everything. It's like a no regrets mentality. Unless I do
Mhm.
everything every single day, I can never live with myself when one of my loved ones actually have a disease.
Yeah.
And I recognize that's also crazy. Like like I recognize when I feel that way, I'm like, well, you didn't have to get up at 3 o'clock this morning and do that. But that's why I say like it's there's an aspect of passion there that is it's somewhat uncontrollable, but it comes from like kind of a dark place. And so it
Mhm.
comes from a place of regrets. And so I think out to being 50, 60, 70, 80, 90, 100. And like you asked me that question, and it's going to be in the context of probably friends and loved ones that we've lost and a feeling of regret that like, did we do everything we could?
Mhm.
Did we find the thing that we could have found if we had just collaborated a little better and worked a little harder? And so that's why the Alloy business model actually is just kind of logical. Like the best way to avoid that regret, like the demon side of that equation, is to try to get medicine to everybody and collect the data and then plow it into the feedback loop of generating insights and then making new medicine to solve that, identifying unmet need and doing it again and again and again. And the more you collaborate, the faster you're going to do that. So it's like a super selfish business model at the end of the day, which involves my own psychological insecurity of the regrets of, heaven forbid, my wife or one of my kids. But your parents and everyone else will grow up and they're older than us, right? So um, it's inevitable, but it comes down to the four existential threats. Like existential psychology says, there's four things that we'll never be able to accept in our lives, and that I'm paraphrasing, but it's that you're going to die alone, nothing you do matters, and it's all your fault. And like it doesn't matter, like, oh, like if you're crying at a movie, it's one of those four things for sure. There's not like a fifth thing; it's always one of those things.
Mhm.
But the inverse of that is a beautiful thing, right? Which is we all just want to live forever, surrounded by the people we love, like working on something where we're the clear architect of our own destiny. And like that's what perfection looks like, I think, in like some philosophical way. And we also, it's just hard to wrap your head around it. So yeah, I mean, looking back on it, today I got up early and we grinded on this. I forgot this was on my calendar, right? This has been a wonderful little interlude into a Friday afternoon.
Mhm.
Um, yeah, it would just kind of round out the day and get back on the horse tomorrow. And there's like a lot of really important work to be done. And the pain of doing that work is what brings me so much joy. If that makes sense. I think that makes sense for you.
It totally makes sense. I can identify and relate to this in so many different realms. But Errik, I mean, first of all, it's been a privilege knowing you for as long as I have, and truly calling you a friend. Yeah, you're an inspiration every time we talk. The few moments that my mind isn't spinning from all the knowledge you're dumping on me, and I can actually connect with something and like draw, connect the dots, makes me feel good about myself because you operate in so many different realms. But since I've known you, your model for life has been so aspirational and so fundamentally good for humanity. Whether you're at Alloy or Adamab or any number of different organizations that you started, that you're one of the few gems that you meet you once and you're like, was this guy real? And then you talk to a second time and then a 50th time and you're like, no, that literally is Errik. And for all those reasons, I think it's just a reason why you've accomplished so much, a reason why so many people believe in you and want to work with you. And again, why I consider myself to be privileged to see you as a friend and for having you here. So for all those things, Errik, it's been wonderful having you here. And
no, you're too nice with that comment. Yeah, but I appreciate that. Thank you, Nick.
No, of course.
And similarly, it's great to know that you're out there in the world, not only doing this, but everything else you're doing. So it's one of those small things, knowing there's other good people in the world. Whereas, as my son said to me, I got off a frustrating phone call, and he looked at me and he goes, "No friends at Twilight, eh, Dad?" And what he was quoting was Tenet, which we had watched a few weeks before. And he's like 15, and it's almost like I've never been more proud in my life because he just like really dialed. I was on a frustrating phone call, and like he knew what we do was really important to me, and I was like frustrated, trying to get something done. He goes, "No friends at Twilight, eh, Dad?"
That's
awesome. That's how I feel. So you are a friend at Twilight, Nick, and there's like a club of folks, and you know who they are. That when you're heading into the darkness, you know who's on your side.
Yeah,
and I appreciate that about you.
Well, I appreciate that yourself. So in any case, thank you again for being on Natural Selection. And next time you're in Boston, let me know. We'd love to get together in person.
All the time. Would love to. Thanks, man.
That was Errik Anderson. Now, Unnatural Signals.
This conversation reframed competition entirely. Instead of extracting value, Errik is building something others depend on, and that dependency becomes the advantage. The signals that we're archiving are: infrastructure can be more powerful than product. Non-zero-sum strategies often outperform extractive ones over long horizons. Doing the opposite of industry norms can open entirely new paths. And when everybody wins, patients win faster. Alloy isn't trying to dominate the ecosystem, it's trying to make it work better. And that may be the most durable strategy of all.
Thanks for listening to Unnatural Selection. If you enjoyed the episode, subscribe, leave a review, and share it with someone shaping the future. Explore more at unnaturalselection.net and connect with us on LinkedIn and Facebook. Until next time, keep evolving.